Hello and welcome to Mississippi Insight. I'm Melanie Christopher in this morning for Byron Brown. This week, COVID-19's fifth wave is hitting folks hard in Mississippi. We'll get an update from the state health officer, and former CDC director Robert Redfield joins us. Dr. Redfield has a new role helping school systems respond to the pandemic. Also, editorial cartoonist Marshall Ramsey will tell us how he'll remember 2021 and what he hopes for in the year ahead. That's all ahead this Sunday on Mississippi Insight. The story of the week has been the huge spike in COVID-19 cases in Mississippi and nationwide. We started the week with new infection cases averaging over 1,100 in Mississippi from December 22nd through the 26th. By the end of the week, we were staring at the 5,000 mark. The Omicron variant is cited in the majority of new cases, but the deadly Delta variant is still out there too. The leadership team at Mississippi's Department of Health returned to the virtual meeting space Wednesday for a news briefing on the pandemic and Omicron. Here's State Health Officer Thomas Dobbs.
So Mississippi is seeing a rapid increase in the number of cases and also a significant rise in the number of hospitalizations due to COVID-19. For the previous week, leading up to December 25th, 59.6% of all identified cases were due to the Omicron variant, and the remainder primarily due to Delta variant. But as of 12/20 and forward of the specimens we've now analyzed, 67% are due to Omicron. Now, Omicron is significantly more contagious than Delta, but fortunately, it does appear to cause less severe illness. But regardless, we will continue to see additional hospitalizations and deaths, and many of which could be avoided. Important to reiterate that vaccination is still an important measure for COVID, especially for Omicron. Boosters are critically important. We know to get full protection against Omicron, folks need to have a booster. And if you've had a recent booster, the protective effect from clinical illness can be as high as 70% or more. So please get your booster if you have not done so. But even so, folks who've been vaccinated are protected from the most severe outcomes of COVID as far as severe illness, hospitalization, and death for the most part. Vaccinated people and those with prior infection can still get COVID with the Omicron variant and spread it. So it's important for people to be safe. You know, we don't have a lot of the monoclonal treatments available right now. We're trying to deploy them as quickly as we can. Most of the monoclonal treatments that we have are not effective against the Omicron variant. So it's important to prevent getting COVID right now while we're waiting. Additional doses of the oral antivirals, which we'll discuss a little bit later on, and then the single form of monoclonal antibodies that is useful against Omicron called sotrovimab. So for the next couple of weeks, please be especially careful especially going into the New Year's holidays. We know how to prevent transmission of COVID. We've seen a lot of transmission in congregate settings. We've seen almost a fourfold increase in the number of outbreaks in long-term care settings. We've seen a lot of outbreaks in social events and in other gatherings. So please be very careful as we go into the next couple of weeks.
That's Dr. Thomas Dobbs speaking on Wednesday. It's just about 2 years since we first started reporting on COVID-19, and one of the people who've led the fight against the coronavirus from the very beginning spoke with 12 News. Dr. Robert Redfield is the former director of the U.S. Centers for Disease Control and Prevention. He's moved on to the private sector now as a senior medical advisor for the firm AM LLC. They work with K through 12 school systems in dealing with pandemic safety and health. Dr. Redfield spoke with 12 News' Jade Bulecza Thursday.
Dr. Redfield, thank you so much for joining us today.
Thanks for having me.
Dr. Redfield, we see the sharp uptick in new case numbers and deaths from COVID-19. What are your thoughts on this latest wave?
Well, it's a significant wave. The new variant, the Omicron variant, is much, much more infectious than the Delta, which was more infectious than UK, which was more infectious than the Hunan variant. Just to give you a reference point, it took about 1.5 to 3 days for a doubling time of all infections with the Omicron variant. And with the Delta, it took 12 days. So it just shows you how much more infectious this virus is. That said, the virus does appear to be less pathogenic, less able to cause significant disease. And part of that is because the virus is shifting how it replicates in the human body. The Delta variant and the previous variants replicated very well in the lower lung. And as a consequence, we saw a lot of people develop pulmonary insufficiency, ended up being hospitalized in the ICU. And as you all know, tragically, we lost over 800,000 sacred lives of people in this nation. This virus seems to not like to replicate in the lower lung. It replicates in the upper airway, up in the oral pharynx, in the nasal sinus passages. And so it's causing less lung disease. It may be also one of the reasons it's more infectious, because its center of replication is right there at the mouth and the nose, where it can contribute that virus to the atmosphere for other people to run into it.
And we just learned this week about the CDC's latest isolation guidance for people who test positive. They've lowered the isolation period from 10 days to 5. What is your reaction to this change?
Yeah, I think it was a smart decision, trying to balance, the isolation from the public health point of view, and recognizing we're really moving to a time where we're going to live with this virus for the duration. This virus is not going to ever go away. It's going to go through different scenarios, and we now know in studying that this virus replicates well 2 or 3 days before symptoms, and then 1 or 2 days after. So I thought it was a careful balance that they did. That if you were about 5 days out, that your infectivity would be lower in general, and trying to get people back into life. So I think it was a prudent, thoughtful, science-based decision that they did. The political decision would have probably been to keep the quarantine much longer. I think they're trying to ground it really in the science that they have.
We'll have more with Dr. Robert Redfield when Mississippi Insight continues. And how you're working with schools in responding to the pandemic.
Yeah, I mean, the AMLLC is a great company. It's really centered around providing increased public health capacity to states, to local health departments, to school districts, and to institutions by giving them not only helping them with strategy on how they want to adopt all the different information into a policy and a strategy, but also helping them with implementation when it comes to vaccination, or when it comes to testing strategies, or comes to contact tracing, isolation strategies. One of the things I learned as CDC director is that this nation has really severely underinvested in public health infrastructure. Many of our states really are highly anemic in their public health capacity. And so this is a company that provides additional capacity to states or local health departments or school districts or institutions to help them navigate and implement important public health policies that can kind of confront COVID. And I serve as one of their strategic advisors to help navigate that territory for them. I also serve as the senior public health advisor for Governor Hogan in the state of Maryland.
Well, tell us, what should parents be thinking as they plan for a return to school following the holiday break?
Well, again, I think the most important thing for them to do is rethink about their decision about vaccination of their children, particularly those 5 and older. There are many parents that have chosen not to vaccinate their children. Only 30% approximately of children 5 to 11 have been vaccinated. I'd like parents to rethink that, because the best defense they have for their kids is to get vaccinated. And even though they may not end up in the hospital, although if you're watching the news, you can see that pediatric hospitalizations have increased substantially over the last several days, and they will continue to increase over the next 3, 4, 5 weeks. But many of these kids that get infected can also develop what I call, COVID fog or long COVID syndrome, because this virus doesn't just replicate in their oral pharynx, it also replicates in other organs, including the brain. And the best way to keep that from happening is to get your children vaccinated. So that's the most important. Secondly, if they've been in high-risk environments and there's a high risk that the child may be infected, I do think that there's advantage to getting tested 48 hours before going back to school to make sure that you're not infected as you go back to the school environment. I'd like parents to support schools that develop programs that I've advocated, which is to do routine testing in those K through 12 twice a week, so that you can identify the asymptomatic infected students and pull them out of the classroom, allow the classrooms to continue, support the idea of what we call test and stay if someone in the classroom gets infected, rather than get hysterical and have everyone pulled out of the classroom. Let the school go ahead and evaluate all of the students by testing. Those that are test negative stay in school, those that test positive get out of school. These are some of the practical things they can do, because it's really important to keep these schools open. It's really a false narrative that somehow virtual learning is somehow equivalent in any way to face-to-face learning. I said this back in 2020 that the public health interest of K through 12 was to keep kids in face-to-face learning, that putting them in virtual learning was not in their public health interest. Many of them lost food support, they lost mental health service support. We saw increase in depression, suicide, drug use. So we really need to keep these schools open. It was a public health mistake that jurisdictions made to shut schools down back in 2020.
Well, thank you so much, Dr. Redfield, for taking the time to speak with us. I know you have a number of other interviews you're doing today, but we appreciate your time, and I could spend all day
thank you very
talking
much.
to you.
Thanks, Jade. Thanks a lot. I hope my sweater brightened your day.
Oh, I love it. Thank you so much, Dr. Redfield.
We'll chat with Marshall Ramsey after a short break. It's Mississippi Insight, only on 12 News. Finding humor in troubled times has really helped a lot of us get through these last 2 years. And our next guest helped remind us, as this year ends, we all have to make the most of the situation and look ahead. Welcome back, everyone. Marshall Ramsey is an award-winning cartoon artist. He's editor-at-large for MississippiToday.org, and he joins us now on Mississippi Insight. Marshall, welcome.
Melanie, Happy New Year. It's always a pleasure to talk to you.
Thank you so much. Same with me. We have some picks from your favorite cartoons of 2021, a list to show our viewers. Now, here's one you just published a few days ago. It's the season for gift returns. And who wouldn't want to return the latest COVID variant, Marshall, right?
I know. I was thinking about, our medical folks have been such heroes for the last 2 years. And here we were just getting through Delta and everything was starting to get back to normal. We had our vaccines, it was working. And then all of a sudden we get yet another variant and we got Omicron. I was just thinking, man, that's just one gift that they did not want.
Absolutely. Now, of course, you've been writing about COVID from the beginning, and earlier this year you focused on the big impact on our intensive care units and those wonderful health providers across the state. Are you concerned now about more strain on doctors and nurses in the year to come?
Yeah, I am. I just, I had back surgery last year. Hey, what a great way to celebrate 2021. And I got to spend a little bit of time in the hospital and talk to the nurses when I wasn't completely overly medicated. But, you could tell that they were tired. And I have several friends that are doctors and nurses too. And in fact, I actually spoke to a group of doctors about 3 weeks ago. And what I got from them was the fact that they are just exhausted. And, this was just one thing more on top of their plate coming up. So I hope that the Omicron turns out to be as mild as what they're suggesting, so that, that they can get a little bit of a break.
Earlier this year, you tipped your hat to the folks at Chick-fil-A with a cartoon warning about taking unapproved treatments for COVID. Don't take cow medicine, paid for by Dr. Dobbs. So there was also this one with storm clouds on the horizon and a simple warning from the National Hurricane Center. Now's a good time to start believing in science. Marshall, we all need to get our heads around the science in the years to come, don't we?
Yeah, it was. In fact, I got to tell you a little interesting aside about that cartoon was that I got an email from one of the forecasters at the National Hurricane Center who actually wants a copy of that. But I don't know. It's the thing about social media, and I love it. I'm on it all the time. It's a big part of what I do. But rumors really can spread quickly, and false information and misinformation. And when people start getting hurt, that's when it becomes kind of a problem. And so that's what those cartoons were about a little bit. And here we were getting hit by hurricanes through that. And if people took weather warnings with the same vein that they've taken some of the other things lately, I think we would be in a whole lot of trouble. But hopefully now people still heed that. I know we've had some severe weather over the weekend too. So hopefully people will continue to listen to Ken South.
We hope so too. It certainly wasn't all bad news though. In 2021, Congress passed the bipartisan infrastructure package, and that means $1.8 billion in stimulus funds for Mississippi. Talk about what you hope the lawmakers will do with all that money and heighten state revenues in 2022.
Well, the session's about to get cranked up, and I'm looking forward to spending some time down at the Capitol and drawing a ton of cartoons about it. But, and I've been in Mississippi now for 25 years. It's hard to believe it. I just passed my 25th anniversary, and I've seen the legislature spend when they have a lot of money, and I've seen when they spend when they don't have a lot of money. And it seems like I get more nervous when they have a ton of money, because then, boy, they start spending it on some really weird things. So it'll be kind of interesting to see if when they dive into that Scrooge McDuck full of gold coins, where those gold coins end up.
Yes, it will. Following the money kept us all busy in 2021. Here's a tune you drew a few weeks ago, an awkward gift exchange with Shad White and Brett Favre. Marshall, I take it you don't think we've seen the last of these two or that welfare fraud scandal in general.
Yeah, that story, and I mean, a big shout out to Anna Wolf at Mississippi Today, who's done a great job on that beat. The thing about that story is it's just some of the spending is just mind numbing, and you can only pray that at the end of the day, maybe we make better decisions when money that's supposed to go to help people who need the money that actually go to them instead of other things. But now the Brett Favre, Shad White saga has turned into kind of, needless to say, they have no love for each other. So it does make for good cartoons.
Well, we can't ignore the year in Mississippi sports. This was Jackson State University's big year in SWAC football, and of course, Coach Prime, Deion Sanders, continues to wow Tiger fans and sports analysts alike. Marshall, I bet a lot of folks sounded off on this cartoon.
Yeah, I tell you what, Melanie, one thing I've discovered about Mississippi is that we're a lot happier people when our football teams are winning. And that goes for all the football teams. It doesn't matter when Mississippi State's winning or Ole Miss or Southern Miss. But I tell you what Coach Prime has done, what Deion Sanders has done for Jackson State is something that it just interests me as a whole leadership thing. His ability to get people to believe, not only because he's always been able to believe in himself. I've always thought his ability to be self-promotional was incredible. But what he has done here for JSU has been nothing short of wonderful and a miracle, and it's bleeding over to the whole city. I mean, I love the excitement, and I'm just so happy for him and for the Tigers.
I am too. All right, Marshall, thank you. And you pay tribute to Mississippi State. Let's not forget them, the NCAA champion baseball team. So that was a wonderful win too for all of us. Any closing thoughts about the year ahead?
I tell you what, I did a cartoon recently, and it wasn't really an editorial cartoon. It was just an illustration, but I showed a dumpster fire and a guy was cooking a marshmallow over it. It's really easy to say, 2021 was terrible. 2022 is going to be terrible. But let me tell you this. I mean, and I'm old enough to know that every year is going to have terrible parts to it, but every year is going to have amazing parts to it too. And I think it's up to all of us to grab a hold of the positive and the good and to try to just hang on to that for dear life, because things are probably going to be bumpy in 2022. But as long as we can keep laughing, I think we're going to be okay.
I think so too. Marshall, thank you again. Marshall Ramsey with MississippiToday.org. As I said before, you are a blessing to all of us. Thank you so much for joining us for the year's first edition of Mississippi Insight.
Been fun. Thank you.
We'll be right back. Thanks again to Dr. Robert Redfield and Mississippi Today's Marshall Ramsey for joining us this week. Byron Brown will be here next weekend with more of the political and current affairs coverage that you demand. I'm Melanie Christopher. From all of us here at 12 News, let's make it a great year.